Hello everyone, welcome to our first set of pre-board examination, Nursing Practice 1 of 4 more board questions. This is going to be part of our board exam essentials, and this is going to consist of 20 item examinations, and this is going to employ test taking strategies and test taking skills in order for you to get the best answer of the questions that will actually be asked in the following items. So let's begin with our first item. Situation number 1. For questions 1 to 5, the nurse is performing a physical assessment of Mr. Go, age 50. The assessment includes the Rene test, auscultation of the heart and lungs, and assessment of the reflexes. Question number 1. In performing the Rene test or Rhine test on Mr. Go, the nurse uses, take note of the word Rene test or the Rhine test. So this is gonna be very important because this is the focus of the question. And choice letter A tuning fork to test whether the patient hears better in one ear. Letter B, a tuning fork to compare sound conduction through air and bone. Letter C, a tuning fork to compare the patient's bone conduction with her own. Or letter D, an ophthalmologist to check the optic disc. Of course, let us eliminate immediately letter D because you're talking about ophthalmologist. Remember, when you talk about your Rene test, you talk about the assessment of hearing acuity of the patient. So this is going to be very wrong. So therefore, we're left with the three answers here in question number 1. So we're talking about letter A, B, and C. Let's take into consideration letter C. A tuning fork to compare the patient's bone conduction and also with her own. So therefore, this is also going to be very wrong. Why? Because we're not comparing our own hearing acuity with the patient. So therefore, we're left with choice letter A and letter B. Letter A, a tuning fork to test whether the patient hears better in one ear. Or letter B, a tuning fork to compare sound conduction through air and bone. Remember, when we do our assessment for the patient's hearing acuity, we have two tests. That is going to be the Weber's test and also the Rene test. And in this question, the question talks about Rene test, and of course, that is basically all about conduction of air. So the best answer for number 1 is letter B. Letter B is the best answer because it says a tuning fork to compare sound conduction through air and bone. So take note on letter A tuning fork to test whether the patient hears better in one ear. It has to be both ears. So it has to be that this is going to be both ears. So the best answer for number 1 is letter B. I hope that you got the correct answer. So just remember, when you are going to assess the patient for Rene test, it is very important for us to take into consideration that you are going to compare the sound conduction of the air through the bone conduction. So the correct answer for number 1 is letter B. Let's now have number 2. Same situation. While auscultating Mr. Go's lungs, the nurse hears short, discrete bubbling sounds during inspiration. These sounds are, take note of the word, the nurse hears short, discrete, and bubbling sounds during inspiration. So just have to remember that the focus is all about inspiration. So let's letter A, friction rub, letter B, ronchi, letter C, wheezes, or letter D, crackles. Just remember that this letter A and letter B are actually that present during inspiration. This is usually present during expiration or during exhalation of air. So therefore, this is going to be wrong. So A and B are already going to be wrong. So in this case, the question is asking discrete bubbling sounds during inspiration. So wheezes and crackles are present during inspiration. But if you're going to take into consideration wheezes, that's grating sounds during inspiration. So the best answer for number 2 is letter D. Letter D, crackles, is best defined as bubbling short sounds during inspiration. So I hope you got the correct answer also. Number 2, the answer is letter D, crackles. That's gonna be your discrete bubbling sounds during inspiration. Let's proceed now to question number 3. Same situation. While auscultating Mr. Go's heart, the nurse listens for the S1 sound. This sound is created by, of course, our heart has two sounds. That's gonna be our Korotkoff sounds. We have your S1 and S2. This sound is created by, so what causes your S1 sound? Is it the closure of the aortic valve? Letter B, the closure of the mitral tricuspid valves. Letter C, the closure of the pulmonic valve. Or letter D, rapid filling of the ventricles. So what is your answer? Okay, let us dissect the question. In this question, the question is actually asking for the sounds of S1. So when you talk about S1, that is basically talking about the AV valve closure. But for S2, that's gonna be your semilunar valve. So when you talk about your semilunar valves, we have your aortic and pulmonic. So therefore, we eliminate letter A and also letter C because this aortic and also with your pulmonic valve are part of your semilunar valves. And here in your S1, that is going to be your AV valves or your atrioventricular valves, and that talks about your mitral and also your tricuspid valve. So the best answer for number 3 is letter B. Letter B is the best answer for number 3. I hope you got the correct answer. And of course, it was not mentioned here what type of ventricles are actually having its rapid filling, and it's going to be either right or the left ventricle. So therefore, it is very important for us to take into consideration the function of our AV valves, and that's going to be the mitral and the tricuspid, the mitral tricuspid valves. So the best answer for number 3 is letter B, and that's going to be closure of the mitral tricuspid valve. Let's now have question number 4. Question number 4. S1 is heard best at the. Same question with number 3. S1 or your sound of the heart for S1, the carrot cup sound, is heard best at the A, fifth left intercostal space along the midclavicular line. B, third intercostal space to the left of the midclavicular line. C, second right intercostal space at the sternal border. Letter D, second left intercostal space at the sternal border. Take note, and in any examination, if there are two choices that has the same thought, they are actually going to be wrong. So we'll eliminate letter C and letter D because they're talking about second, either right or left. And take note, if you're going to take into consideration the point of maximum impulse or the PMI, that is going to be in the letter A. So the best answer for number 4 is letter A. That is going to be the fifth left intercostal space along the midclavicular line. You cannot actually be able to hear your S1 sound at the third intercostal space, but it's gonna be the midclavicular line to the left. But of course, it has to be at the fifth intercostal space. So therefore, the best answer for number 4 is letter A. So let's proceed now to the fifth question. Number 5, same situation. In assessing Mr. Go's plantar reflex, the nurse expects which of the following responses? Take note of the word plantar reflex. So when you talk about the plantar reflex, it talks about the foot part. So that's letter A, dorsiflexion of the great toe and fanning of the other toes. Letter B, extension of the lower leg at the knee. Letter C, flexion of the knee. Letter D, flexion of the toes. Of course, when you talk about the plantar reflex, this reflex is basically present specifically for the toe area. So therefore, letter A and letter D might have been the correct answer. So let's eliminate letter B and letter C, because letter B talks about the knee, and of course letter C also talks about the knee. So the above mentioned earlier that if there are two choices in the examination which has the same thought, it means that's going to be a wrong answer. So in this case, if you're talking about plantar reflex, when we say plantar, it means fanning. Plantar, fanning. So the best answer for number 5 is letter A. So the best answer for number 5 is letter A. So when we say dorsiflexion of the great toe, this is the big toe, and fanning of the other toes. When we say fanning, it means that there is a separation, or there's gonna be abduction of the other toes. So that's gonna be creating distance from each other. So that is fanning of the other toes. When you say flexion of the toes, you can do flexion of the toes. That's gonna be probably signs of Babinski reflex. So in this case, the best answer for number 5 is letter A. So just remember, plantar reflex, there is fanning of the other toes. Let's have now our next question. So question number 5, the best answer is letter A. Let's now have question number 6. Situation. Situation number 2, Mr. Bruce, age 40, is admitted to the hospital with a diagnosis of right lower lobe pneumonia. He is slightly dyspneic at rest and is receiving 2 liters of oxygen by nasal cannula. His vital signs are temperature of 101.1 degree Fahrenheit, or that's 38.4 degrees Celsius, pulse rate of 100 beats per minute, respiratory rate of 22 breaths per minute, and blood pressure of 136 over 74 millimeters mercury. The physician starts an IV line for antibiotic administration. Number 6. Which nursing diagnosis will be the first priority? Take note of the word first priority. So it means that this has to be addressed as soon as possible because it might actually going to cause untoward complications to your patient. Letter A, altered tissue perfusion related to inflammation. Letter B, impaired skin integrity related to IV puncture. Letter C, potential for impaired gas exchange related to infection and inflammation. Letter D, impaired gas exchange related to infection. So just remember, if you're talking about priority, the first priority, of course, the first prioritization that we're going to have always is we have your A, B, C, D, E. So that's gonna be the airway, breathing, circulation, disability, and exposure. So this is gonna be our first priority. So therefore, our answer for number 6, that's letter D, impaired gas exchange, because this is actually priority number 1 because you focus on the airway of the patient. So that is letter D. So when you say potential for impaired gas exchange, there's no such thing as NANDA problem for potential. So this is gonna be very wrong. And take note, impaired skin integrity is not a priority this time because of course when you talk about impaired skin integrity, we are going to focus on probably having a risk for possible infection, and altered tissue perfusion related to inflammation. That is basically all about the circulation part of the first prioritization. So the best answer for number 6 is letter D. So that's letter D. Let's now have question number 7. Same situation, which of the following breath sounds auscultated on Mr. Bruce are abnormal? Again, which of the following breath sounds auscultated on Mr. Bruce are abnormal? So we'll take into consideration breath sounds, and we're talking here abnormal. So just remember, we have your 3 most common normal breath sounds. We have your bronchial sounds, vesicular sounds, and bronchovesicular sounds. So therefore, it is very important for us to remember that these are going to be the focus of the questions or this question. So when you talk about vesicular sounds heard over the left lung, letter B, bronchial sounds over the trachea. Letter C, bronchiovesicular sounds between the scapula. Or letter D, bronchial sounds over the right lobe. Okay, so just have to remember, if you're talking about bronchial sounds, it means that according to statistics, that can be heard with a naked ear. When you say naked ear, it means that you're not going to use any stethoscope or any device that you're going to use in auscultating that one. So therefore, that can be heard over the trachea. So therefore, correct po yung letter. We're looking for a wrong answer here kasi we're looking for an abnormal breath sounds for the patient. So therefore, bronchial sounds over the trachea, this is actually expected. This is considered to be normal. And of course, your letter A also is normal because this is going to be correct, that you're going to hear the vesicular sounds over the left lung. So it's between C or D. So the best answer is letter D. Letter D, bronchial sounds over the right lower lobe. So that is not expected to be heard in the right lower lobe. It's because here you will be able to hear vesicular sounds in the lobe of the lungs of the patient. So therefore, bronchial sounds can be heard best using or over the trachea. So the best answer for number 7 is letter D. So I hope you got the correct answer. So let's proceed now to the question number 8. Question number 8. Mr. Bruce's skin should be assessed for. So we're talking here on the assessment of the skin of our patient. So let's have letter A, temperature, moisture, and turgor. Letter B, mobility, turgor, and integrity. Letter C, vascularity, evidence of bleeding and edema. Or letter D, all of the above. Of course, we might actually going to answer letter D, but we're going to dissect each of the choices. Let's have letter C. Letter C, correct po yung vascularity, but of course, we will not be focusing more on evidence of bleeding because of course here we're actually assessing the patient with possible pneumonia. So of course, you're not expect that there's risk for possible bleeding. Of course, since letter C is already considered to be wrong, so it's also gonna be wrong ang letter D na all of the above. We're left with letter A and letter B. So in this case, let's have letter B. Mobility, is it movement of the skin? So that's gonna be the wrong word to use because probably what is the author trying to say here is the word skin trigger. So in that case, that's gonna be wrong. So the best answer for number 8 is letter A. So that's temperature. We're going to assess if the temperature is gonna be warm, moisture, because of course if the skin is actually dry, then there is an indication that the possibility of this patient to have possible dehydration. And also the skin trigger has to be assessed properly if the skin is going to return back as soon as it's actually being assessed. So as much as possible, there has to be normal skin trigger. So the best answer for number 8 is letter A. So I hope that you are going to correct you have the correct answer. So answer for number 8, letter A. Let's now have question number 9. During the assessment or during the nursing history, Mr. Bruce says he has had congestive heart failure. Which of the following would be most pertinent to this diagnosis? Again, during the nursing history, Mr. Bruce says he has congestive heart failure. Which of the following would be most pertinent to this diagnosis? A family history of coronary artery disease, asthma, and diabetes. Letter B, a history of periorbital edema and intermittent claudication. Letter C, a recent history of peripheral edema and emphysema and dyspnea. Letter D, a family history of hypertension, rheumatic heart disease, and tuberculosis. Take note of the question that the patient has this congestive heart failure. So from the word itself, there is congestion. So you see there is going to be congestion, you expect that this patient will be manifesting dyspnea. So if there will be presence of dyspnea, so therefore we're looking for the word dyspnea. For patients having a history of coronary artery disease, this is gonna be a heart condition, but this is usually not leading to congestive heart failure. Probably your coronary artery disease leads to myocardial or heart failure. So and of course the asthma, there's no risk of asthma for the patient, and also with diabetes. So letter A is basically wrong. Letter D, a family history of hypertension. Hypertension results into cardiac failure, and rheumatic heart disease is also for cardiac failure. And the worst thing is the patient has this tuberculosis, and this is actually going to be not expected for patients with congestive heart failure. So therefore we're left with letter B and letter C. Some individuals will actually say that because of congestion, the patient will be manifesting this edema. Take note of the word periorbital edema. The one that causes your periorbital edema is basically not the congestive heart failure, but sometimes it is brought about by those conditions that includes your hyperthyroidism and also with your hypothyroidism. And intermittent claudication, this is actually going to be present, especially if there is pain at the extremities because of reduced in perfusion. So the best answer for number 9 is letter C. So the best answer is recent history of peripheral edema, emphysema, and dyspnea. So just take note, if there will be congestive heart failure, the focus here is basically on presence of dyspnea, because the presence of dyspnea is brought about by the congestion of the patient's lungs. So the best answer is letter C. That's letter C for number 9. Let's now have question number 10. Situation number 3. Mrs. Wallace, an Aita, age 64, has returned from the recovery room after having a bronchoscopy. Of course, we know that bronchoscopy is basically an imaging study that is going to have an image of our entire lungs. Number 10. Which aspect of Mrs. Wallace's mental status should the nurse assess at this point? Letter A, memory. Is it the memory? Letter B, intellectual performance. Letter C, personality changes. Or letter D, level of consciousness. Of course, as what I mentioned earlier, we have to eliminate choices that has the same thought. Of course, we'll eliminate letter A and also with letter B because memory and intellectual performance are the same. This talks about the mental cognition or the ability to um, recall things. So we're left with two choices. Let's letter C and D. Of course, which mental status? When you say mental status, of course, it is very important for us to take into consideration the level of consciousness of our patient. So the best answer for number 10 is letter D. So that is letter D for number 10. Let's now have question number 11. The nurse determines that Mrs. Wallace is lethargic because she, take note of the word lethargic. So lethargic is basically gonna be levels of consciousness that starts with alert, awake, lethargy, stuporous, and of course, it will actually progress towards a slight coma or light coma, and of course your deep coma. So letter A, responds immediately to people and surroundings. Letter B, sleeps but can be easily aroused by touch. Letter C, maintains consciousness only with constant stimulation. Or letter D, cannot be roused from sleep. So of course, when you talk about lethargy, the patient here is drowsy. So when you say letter A, uh, responds immediately to people and surroundings, that's gonna be the patient is alert and awake. And of course, letter D, cannot be aroused or cannot be aroused from sleep. This is gonna be coma patient. So that's B or C. So the best answer here is letter B. So answer for number 11 is letter B. Patients sleep can be aroused by means of touch. That's gonna be the definition of letter G. Letter C, maintains consciousness only with constant stimulation. This is gonna be for stuporous patient. So stuporous is usually going to be present right after your letter G. So the best answer for number 11 is letter B. Let's now have number 12. The nurse suspects that Mrs. Wallace has an acute bacterial respiratory tract infection because the sputum collected is. Again, the nurse suspects Mrs. Wallace has an acute bacterial respiratory tract infection because the sputum collected is letter A, pink and frothy, B, blood tinge, letter C, clear and watery, letter D, thick and yellow. Take note of the word acute bacterial infection. So when you say acute, it means that that's gonna be recently diagnosed condition. Letter A, pink and frothy. This is for chronic. Blood tinge is also chronic. Letter A and letter B is talking about possible TB. And take note, TB is basically chronic conditions of the lungs. And of course, in this case, the patient probably have a risk for pneumonia. And of course, letter C, clear and watery. This is specific for patients who have had asthma. So that is gonna be specific for patients who have had asthma. So therefore, the answer for number 12 is letter D, thick and yellow. From the word yellow, it means that it is already a sign that there is an ongoing infection that is happening with the patient's respiratory tract. So therefore, there is thick and yellow sputum. So that's the correct answer for number 12. Let's proceed now to the next number. Number 13, the most appropriate site at which to evaluate Mrs. Wallace for cyanosis is, take note, patient is actually AITA. So therefore, if AITA yung mga pasyente, it is expected na medyo dark po yung skin pigmentation nila or skin complexion. So in this case, are we going to look for the feet, the fingers, the skin, or the nail beds? And take note, feet and the fingers are feet, and also it's not mentioned kung saan portions of feet, and also the skin is actually going to be dark in color, so therefore it is not the best site for us to assess for cyanosis. And the best site for us to assess cyanosis for patients who have had dark complexion skin is basically the mucosal area and also the nail bed. So the best answer for number 13 is letter D. So the best answer for number 13 is letter D. Let's proceed now to the next question. Number 14. Which of the following symptoms indicate beginning hypoxia? Again, which of the following symptoms indicate beginning hypoxia? Is it cyanosis, tachycardia, and vertigo? Letter B, dyspnea, restlessness, and cyanosis. Letter C, restlessness, tachypnea, and tachycardia. Or letter D, cyanosis, tachypnea, and tachycardia. I've mentioned earlier that if there are choices that has the same thought, of course, that's going to be wrong. Take note of the word beginning hypoxia. So you say beginning hypoxia, it's not expected na meron siyang cyanosis. So letter A is wrong. Letter B is also wrong because it has cyanosis, and also letter D is wrong because it has cyanosis. Cyanosis is signs of late hypoxia. So the best answer for number 14 is letter C. So letter C is the best answer for number 14. Take note, restlessness is the earliest sign of the patient, especially if there is signs of possible hypoxia. So just remember, restlessness, if there's no word restlessness, look for the word irritability. So the best answer for number 14 is letter C. Letter C is the best answer. Next, let's have now the next question. 15. Which of the following symptoms suggest long-term respiratory impairment? Take note of the word long-term respiratory impairment. When you say long-term respiratory impairment, it means that the patient here has a long-term or chronic form of respiratory ailment. Let's have letter A, clubbing of the fingers. Letter B, circummural pallor. Letter C, transudation. Letter D, Raynaud's phenomenon. Take note, all of this are actually signs of possible complications of a long-term condition, especially for chronic conditions of the conditions of the lungs, and there is a problem with transportation of your oxygen. Take note of Raynaud's phenomenon. This is specific for clients who have been exposed to have extremes of temperatures wherein there is actually going to be lack of circulation to the vital organs or the extremities. Take note of the word respiratory ang tinitignan natin. So that's gonna be wrong. Letter B also is gonna be talking about circulation. So letter B and letter D are basically gonna be eliminated. So let's have letter A and C. So the best answer for number 15 is letter A, clubbing of fingers. So take note, if there is gonna be clubbing of fingers, that might actually be a sign that this patient is actually having long-term respiratory impairment already. So number 15 answer letter A. Let's now have the last 5 questions. Situation number 4. Mrs. Kate, a 40-year-old mother of 6, is admitted to the hospital with chronic severe lower back pain. Number 16. Which of the following is most useful? Take note of the word most useful in determining the severity of Kate's pain. So you see, determining the severity of Kate's pain. A, vital signs. B, a descriptive scale. Letter C, facial grimaces. Letter D, the patient's subjective account. Of course, when you talk about vital signs, there might actually gonna be changes in the patient's vital signs, especially if the patient is actually in pain. And also, facial grimaces are actually applicable for patients who are actually pediatrics when we are going to use the Wong-Baker's assessment of pain scale. So it's gonna be between B or D. Take note of the word most useful. So the best answer here is letter B, because when you talk about descriptive scale, you're talking about the 0 to 10 pain scale of the patient. Letter D, the patient's subjective account. Mrs. Subjective account, sakit akong koto-koto. So in that case, you are not sure what level of pain the patient is experiencing. So therefore, it's very important for you to make sure na meron siyang descriptive scale. There is gonna be a descriptive scale that has that the patient actually tells you, especially with regards to the kind of pain that he or she has. So the best answer for number 16 is letter B, descriptive scale. Let's now have the next question. 17. Which of the following questions would be most appropriate in trying to pinpoint the characteristics of Mrs. Kate's pain? Again, which of the following questions would be most appropriate in trying to pinpoint the characteristics of Mrs. Kate's pain? A, is your pain throbbing or crushing? Letter B, how severe is your pain? Letter C, can you describe your pain for me? Or letter D, when does your pain hurt most? Okay, so in this case, the question is asking about trying to pinpoint the characteristics. Characteristics. When it's characteristic, it means that it's not only one characteristic of the pain. So it is very important for us to know the P, Q, R, S, T. Letter P is the precipitating or the provoking factor. Letter Q is quality. Letter R is radiation. Letter S is severity. And of course, letter T is timing. So therefore, that's going to be the characteristics of the pain that you're going to assess. So in this case, letter A is basically throbbing or crushing. That's gonna be quality. So isa lang po siya. We're looking for letter S here, characteristics as plural. So letter A is strong. How severe is your pain? That's letter S. Severe, one characteristic only. So it's gonna be wrong also. Letter D, when does your pain hurt most? That's gonna be the precipitating or the provoking factor. So that's gonna be wrong also. The best answer for number 17 is letter C. Can you describe your pain for me? So that's gonna be the correct answer for number 17. Let's now have question number 18. Mrs. Kate consistently requests her pain medication a half hour earlier than the 4-hour time span ordered between doses. The nurse is convinced the patient requests the medications earlier because she fears no one will be available when she really needs it. The nurse can best help Mrs. Kate by A. promptly attending to her needs and establishing a strong therapeutic relationship. B. explaining that she does not feel Mrs. Kate's need the pain medication as frequently as possible. Letter C. telling her that if she promises to wait until the recommended time, the nurse will give her the medication on time. Or letter D. telling her that she should try to extend the time between doses to increase her pain tolerance. Take note of the word best help Mrs. Kate. So we say best help Mrs. Kate. Of course, the focus of this one is being therapeutic. So the best answer for number 18 is letter A. So letter B is wrong because of the word doesn't. That's gonna be negative. Letter D is also wrong because of the word extend. That's negative. Then letter C, telling her that if she promises, that's gonna be a false reassurance. It's gonna also negative. So the best answer for number 18 is letter A. So that is letter A. Next question. Last two. Mrs. Kate's pain prevents her from having a restful night. Which of the following interventions would be non-therapeutic in this time? So take note of the word non-therapeutic in this time. A. Turning the radio to soft, relaxing music. B. Administering a soothing back rub. Letter C. Saying, I believe this will help while administering an analgesic. Or letter D. Having the client talk about her pain. So answer is letter D. Why? Because this time, the patient has to rest. Kailangan siyang matulog, and it's not gonna be the best time for you to talk about the patient, especially with the patient's pain, because of course you have had to assess that one prior to the patient's restful night. So the best answer for number 19 is letter D. Let's now have the last question for this batch or for this set. Which of the following subjects is most controversial in discussions about pain perception? Again, which of the following subjects is most controversial in discussions about pain perception? A. Physiologic factors. B. The gate control theory. C. Psychological factors. Or letter D. Endorphins. Of course, when you talk about most controversial, of course, we take into consideration here experimental studies of our patient. So when experimental, it means that there has to be clinical data to prove that exists. So when say physiologic factor, it might actually gonna be not controversial because of course you are just going to assess the patient's signs and symptoms. And also with your psychological, take note, psychological and endorphins are also part of psychological and also with your physiologic. So the best answer for number 20 is letter B, because in your gate control theory, patient here has to be subjected to a clinical study. So therefore, it is going to be a controversial discussion because, of course, it involves human as a subject for research. So in that case, it is going to be the best answer, the gate control theory. Okay, so how far is your score? I hope that you get 20 over 20. Of course, this is just the first set of our examination. And of course, this is going to be the first set of our pre-board examination for Nursing Practice 1. I hope that you're going to continue watching our next episode of this channel for board exam essentials, because we'll be using former board questions, which is also going to be very essential in the preparation of your board examination. This has been Nurse Jose at your service to make your best even better. To God be the glory.